This video is going to go over controlling life-threatening bleeding when you only have basic first aid supplies available. So first thing we need to do is find the source of the bleeding. Sometimes you're already going to have clothing that's lacerated or cut near the area. That's going to make it more obvious. You're looking for pooling of blood around the area. And if someone's wearing more waterproof pants, you may need to kind of get under those clothing to feel inside. If the patient's unconscious and bleeding's not obvious, you're going to take your hands, feel from head to toe around the patient, and check your hands as you go. Once you find that source of bleeding, you want to expose that area. So if it's already cut, you can just kind of widen that wound. If you don't have a good access, using things like trauma shears where you can cut a window and now you can tear a nice hole into where you're looking, that's going to help you gain access to where the bleeding is. A big part of bleeding control is well-aimed directed pressure, which means we need to get to that hose, either that vein or that artery that's creating this bleeding. We need to get pressure right on that. We also want to allow that blood to have an opportunity to clot. So we need to get some gauze, something that's going to allow that clotting blood to take hold. So in some of our basic kits, we have compress dressings or roller gauze or abdominal pads. These are really good to pack in. We'll go over the compress dressing. This one's quite common in a lot of first aid kits. So this one here has our roller gauze just attached to a dressing. So what we can do with this is pack this tightly into the wound, as tight as we can get it. And if it's a deep hole, you want to go right in there, get that really packed in, and then leave whatever's extra on top. And the big thing with bleeding control is firm pressure. So we're going to place both our hands on top, use all of our pressure to really hold down on that bleeding. And we want to hold this on for 5 minutes. So I'm not going to do anything else other than call 911, have EMS on the way, and then we're just going to hold pressure. As long as blood's still not pouring out or massively leaking out of this area, we have good control. So this is the best thing we can do for the patient, is just hold that good manual pressure for a good 5 minutes.